Hello, everyone. I am Dr. Brittany Panico, the Chief Rheumatologist at Summit Rheumatology in Gilbert, Arizona. And I have a very special and amazing guest here today from the Seattle area, Dr. Dada. She is here from Overlake Arthritis and Osteoporosis Center. And we're here to talk about all things rheumatology. We're both rheumatologists, and I brought her on today to talk to us a little bit about exercise. We both get lots of questions from our patients about how we can fit in exercise with an autoimmune or arthritis condition. And then she also focuses on osteoporosis treatment. So we'll talk a little bit about that as well. So welcome, Dr. Dada. Please tell us a little bit about yourself.
Right. Oh, thank you so much, Dr. Panico, for having me on your show. I love listening to you, and every time I listen to you, it's always interesting how much our interests overlap. And so my name is Dr. Arinola Dada. I'm a rheumatologist in the greater Seattle area, Overlake arthritis and osteoporosis. We see patients with a wide array of autoimmune conditions, including gout, lupus, rheumatoid arthritis, osteoporosis. And so anything rheumatology, we would see them. I help people with autoimmune diseases get the immune system back on track, and people with joint pain become pain-free.
I love that. I love that tagline. I need to develop a better one for myself, because I think that's so great to just say, I help patients get better, essentially. And I love that phrase. So, well, awesome. I'm so excited to have you here, and, for us to just chat about why we both, love rheumatology. It's so fun to have another rheumatologist. So one of the things that I get asked a lot from my patients, especially a new diagnosis of, let's say, rheumatoid arthritis or psoriatic arthritis, or even gout, where somebody comes in and they may have one or two or more sort of swollen, tender joints. We've talked about treatment. We're working towards a diagnosis. And then it seems like at the end of the visit, there's always that, well, what about exercise? I'm a pretty active person, living in Arizona. We have a lot of hikers, a lot of people who are really active year round. So they'll ask, what about exercise? What can I exercise, number one? And then what kind of exercise should I be doing? So for you, because you also do a lot of exercise on your show, and I think it's so helpful to talk about that. But what do you tell your patients who are newly diagnosed, or let's say even going through a flare, where they're not quite in remission, they still have pain, they still have a very vulnerable area, right, a joint or more? How do you help them sort of decipher what kind of movement we should be doing with our body?
I think that's a very important question, and you're right. And I'm a big fan of exercise because that's what, we're all living longer and longer. And the ability to exercise, strengthen our muscles, and protect our joints is what's going to help us be that 85, 90-year-old that can still run after their grandkids, right? And so people with autoimmune disease, I would say it's not a one size fits all, though. I think it would have to depend on what condition we're talking about, right? Mm-hmm. So an example of is a patient with gout, for instance, right? When that toe feels like someone just smashed it with a hammer, because you have an acute attack of gout, you really probably shouldn't go on that long hike that you were planning, right? For gout, it's pretty simple. Once you're pain-free, go ahead and do what you want to do, right? Because during the time when the crystals are agitated in gout and there's that inflammation, it's really difficult to go and start putting pressure, because you can still aggravate that attack more. Usually the gout attacks, especially if you get treatment, Dr. Panico is an expert at that too. If you get treatment, you can really get that gout attack resolved pretty quickly. And then, so I would say in between your attacks, hopefully you don't have a lot of them. If you have gout, that's the time to go do your exercise. And I would say we probably don't really have any limits on your exercising when you have gout. But I would say one caveat to that is when people are on prednisone, especially on high doses, they do have to be careful of like high impact exercises, right? Because it can cause some hip joint damage. So with prednisone, I tell my patients, just take it easy till you're off the prednisone, right?
Yeah,
and
it's really so important.
Yeah, it's very hard to predict who will get this weird fracture when they're on prednisone. So I would say if you're on prednisone, that would be the caveat. Other than that, I would say people with gout, for instance, go do you when you're not having an attack, right? People with rheumatoid arthritis and lupus and kind of the more chronic inflammatory conditions, I would say just pace yourself, right? I had a patient who runs Like each time she sees me, she's like, so can I start running? So can I start running? And I'm like, okay, let's work on it, right? So that's why you do need your doctor, your physical therapist, because it's not a one size fits all. So the example of that patient is her knee was swollen. So we took some fluid out, we injected it with steroids, that got better. And then her hip was bothering her. So I said, let's get your inflammation under control. And also let me get you off that prednisone before you go for that, 10K run, right? So, but I think if you express to your doctor, your rheumatologist, like, hey, this is an important part of my life, then I think your doctor would help you guide towards that. But I think a general statement would be, go slow, right? Go slow, make sure you're doing your stretching. If you have a swollen joint, get it addressed, because what we would hate is, let's say you decide to go for a run, your knee is swollen, you're kind of running through the pain, but when your knee is swollen, it also means your knee is a little unstable, right? And then you're more likely to get injured. And then we go from just inflammation to now a meniscus tear or something. So I would say, you could go for things that are slow, right? And where you can turn back. So you can go for a hike and just kind of see how you feel. You can go for walks, you can even climb staircase, things like that. But if you're going fast and aggressive, then I think you're more likely to get injured, especially when your joints are swollen. Because I think the thing to remember is when your joint is swollen, your ability, your proprioception, right? Your ability to kind of know where your joint is without you thinking about it is a little off. And so I think you're more prone to injuries when you have swollen joints. So I would say go slow, be careful, do low impact while you and your doctor kind of work on the rest. I hope that's helpful.
Yes, that's great. And I tell my patients, virtually the same thing as well. Low impact, so not a lot of jumping, squatting, things that put a lot of pressure on the joints, especially like the knees, the hips. And I love that you brought up that point about prednisone, and that's something I can definitely get better about telling my patients as well, as when you're on high doses or chronic steroids, that we really do want to help protect those joints and the fragility of those joints. So exactly. And we can kind of segue into the osteoporosis sort of discussion in a bit. I don't want to get too far ahead of ourselves, but again, injuring your body with a fracture is, part of the process and kind of how we gauge, whether or not somebody warrants treatment for osteoporosis. So before we get into that though, with the exercise topic too, is there a point that you find that you start to refer your patients, let's say, to physical therapy or occupational therapy? Do you mostly kind of wait for patients to ask you if that's something they need? Is it something you're more proactive about when you're working with them to rehab a certain joint or area?
Yeah, I think we're very proactive. I would say most patients are, they're just going to try to tough it, and they also, a lot of people don't really understand the benefits of physical therapy. They're like, is it just to move my arm back and forth? I can do it at home. And so I think a lot of it, we do spend a significant amount of time educating our patients, providing them with examples of how things have gotten better. I tell my patients often, I had a knee injury, and I have a number of physical therapists that we've worked with, and I have one that she kind of brought my knee back to life, right? And so I tell them that, and they're like, well, I'm like, if Dr. Dada can make time for physical therapy, you need to make time for physical therapy. And so they're like, okay, fine, So sometimes you just kind of have to tell them kind of, hey, these are examples of, this is what I want the physical therapist to do. Right. And a lot of times for my patients that are really active, sometimes just a couple of visits, they're very motivated and active. But I'm like, well, I need them to strengthen particular tendons or particular muscle groups. And, you go for the visits, the physical therapist tells you what to do, you do them, you go back, you get more exercises. And then a lot of times it's also kind of just a way of life, right? So, some people, you have back pain, you do this set of exercises, you get up and go, right? And so I think we usually don't want to wait for patients to tell us that they need physical therapy. They usually don't want to go. Usually we have to encourage them to go and be compliant. But almost every time my patient tells me, I'm so glad I went, right? Because I tell them, I'm like, especially for back pain, if physical therapy doesn't work, then we're looking at more invasive things, right? So let's try to make physical therapy work. And I would say 90% of the time, there is some improvement with physical therapy.
Yeah, that's a great approach. And I like to the conversation about let's try to make it work, because the next step is going to be that much harder, right, to overcome. So yeah, that's a great message. So, well, now we can segue into osteoporosis. So, we talk a lot about weight-bearing exercise in women particularly, but men also, and just how that helps our bones sort of maintain strength and density over time and as we age. And so, how does your approach for exercise, or does it change as, so let's say for patients who don't necessarily have an arthritis condition, but we're looking at them for osteopenia or osteoporosis, and how is your approach to exercise different with those types of patients?
Yeah, so as I think most of your audience already realize that osteoporosis is thin bones, and we're particularly concerned about thin bones in women. Osteoporosis tends to be common as women become menopausal. So after menopause, we tend to lose bone density, and so so we want to try to do everything that we can before we even start thinking about medications that we can do to improve bone density. So we typically recommend that our patients go for walks at least 30 minutes a day. And I tell them it doesn't have to be aggressive, doesn't have to be running. I just want your feet on the ground with gravity, just walking 30 minutes a day, right? And it's important. I like to ride my bicycle. That's all well and good, but I still need your feet on the ground, and just that effect on gravity. I swim. I need the feet on the ground, And so the weight bearing exercise, like you said, Dr. Panico, is very important to build the bone density. Quick thing, I think a few years ago, I took my daughter to, we're in Seattle, so Boeing Museum of Flight, and there was some article about astronauts when they go up to the space center. They actually lose bone density because they don't have gravity. And I'm like, oh my gosh, right? So
it's fascinating,
they actually practice like weight-bearing exercise with like backpacks and stuff while they're on the ground to try to build their bone density. And even when they're up there in the space shuttle, they're actually doing certain exercises to try to prevent bone loss, right? So it's really the effect of gravity on the bones that's very helpful. The other thing that I tell patients is the strengthening. And people wonder, how do and I'm not asking you to build muscles like Hulk Hogan, right? What we're saying is actually just strengthening and toning. And when we're younger, I give my patients this analogy. If you see a bunch of teenagers coming out of the grocery store, they are multitasking. They're doing like 10 different things. They're texting, they're on their phone, they're singing, they're dancing, they're doing whatever. The ground at the front of the grocery store is uneven. They walk past, they don't even notice the thing, right? You are 90 years old, and you are totally focused on the ground in front of you, but still you fall. And the reason we fall is because we've lost proprioception, right? So we've lost the ability to determine a quick reflex reaction when there's a change in the position of our joints. And so one of the things that we can do to enhance that is when we strengthen our muscles and tendons, and we allow that reflex to be maintained. So as we get older, when we strengthen muscles, tendons, when we're walking in front of the grocery store at 90, your muscles, tendons are still pretty taut, and they're able to reflexly correct your posture so that you do not fall, right? So a big part of osteoporosis for your doctors is really, they want to prevent the fall. That's the bottom line. They want to prevent the fall that breaks the bone, right? And so the strengthening, the walking, at least the three basic things that we can do for ourselves to improve our bone density.
Yeah, that's great. And I love that analogy. I'm going to have to start telling a similar story, because the impact, right? The visualization of that makes so much sense. And I notice that even now, a lot of patients that we're seeing after COVID, after having COVID, are having disequilibrium sensations or a lot more vertigo, right? And so plus you combine that with medication effects of a lot of our medications that we use, blood pressure medications, right? People can feel dizzy or lightheaded. So that's so powerful, that visualization, because it's true, we're walking around, not necessarily thinking about falling, but trying to focus, right? And then it still happens. And it's just because of our, body's awareness and space. And so, yeah, I think too, what you mentioned about toning is so important, because also, to kind of piggyback with what you were saying, is the muscle memory, right? So the more active your body is, the more sort of movements your brain does automatically without thinking so much about it. It's that reflex, right? You're enhancing that reflex. So so that's super, super important. I think too, one thing that I see a lot of as, as our patients retire and kind of get into that, again, postmenopausal phase of life, is they start getting pets or puppies or, something that's underfoot, right? So I have a lot of patients who tell me, I'm so careful. And then I tripped on my puppy, or I, tripped over the leash or something like that, where it seems so like such a silly thing to them. But the truth is, all of these obstacles, right, are other things that we have to keep track of, and our risks for falling. So it is important, to have that discussion of, when we ask you kind of about fall risk or what sort of obstacles you have at home, pets are are something that we kind of just have to keep in the back of our mind, that as we think about getting a puppy for maybe somebody like our parent, right, for example, is we don't want to necessarily increase their risk of falling.
That's true. That is actually pretty damn true. You're buying a puppy for your mom, and then that, oh my goodness, I could have done that, not knowing that I'm buying what's gonna make her trip and fall. Oh, okay, thank you.
Well, I don't mean to sound it like, we're not doing those things with any intention, but
no, you're doing it because you're like, oh, mom would love this. It's such a cute puppy, and I'm partial to dogs. But yeah, totally. But you kind of have to think about it, right? And think about the repercussions, right? So,
or just the awareness of, kind of how we train our pets to be by our side, right? If they're by your side and they're following you, even to the bathroom or through the kitchen, we just have to be aware of that too.
Yeah. Wow. Okay, that's a good one.
Yeah. Well, do you have any tips, 2 or 3 tips of, I guess, wrapping it up with exercise and just joint health in general, and then, how we can tie that into bone health?
Yeah. So, I think that if you're not used to exercising, there's a tendency to just feel overwhelmed, right? I mean, you have people that are excited and say, oh, we walked 5 miles today, we did this, we did that. There is no comparitis, right? Don't get stuck in that. Just start where you are, right? If it means getting up, go to the mailbox, walk as far as that, let that be day one, right? And then, you start adding a little bit more. We're in the Northwest area, right? So it's beautiful now. But, I tell my patients, sometimes they tell me, hey, it's raining today. I'm like, oh, we're in the Northwest. Okay, it's gonna be, we're not in Arizona like Dr. Panico, so it's gonna be rainy. So you're gonna put on your umbrella, you're gonna take your umbrella, you're gonna go to the mall if you want to walk indoors, and you can walk around the mall, right? So start where you are, knowing that there are certain things that are gonna happen. It's gonna rain in Seattle, right? And so it's gonna happen, and so then plan for it, right? You don't have to go to the gym if you're not a gym person. Find your body, right? So one is try to start where you are. The other thing is find your body. Don't find somebody who's going to talk you out of what you want to do. You don't want those ones. Some people are good for going to have lunch with, and some people are good for going to exercise with. So find your body. I love to listen to music when I exercise, because otherwise sometimes the monotony of it gets to me. And so I like to listen to music, distract myself, and then I get it done. I like to get up early and plan for it and just get it done and then get on with my day. And so, because I think some people are very good in the evening, they're more disciplined, but I think just getting it done early and then moving on with your life is important. And then, if you are a woman who's kind of hitting menopause, I would say every woman over 50 should probably get a bone density test, which is a scan that looks at how strong your bones are. And actually, the studies show that most men over 70 should also consider getting at least one bone density test. They're relatively inexpensive tests. You lie down, the scan goes over you, the results pop out, no significant amount of radiation. So I think it's probably worthwhile for patients to do. So I think those are my 3 steps, 3 hints. Start where you are, grab a body, get a bone density test if you're at the right age.
I love it. I love it. And thank you for the recap. Yes. So start where you are, grab a buddy, and get your bone density test. That's very, very helpful. So excellent. Amazing. Well, I have one more question for you. So when I was on your show, you asked me about what kind of superpower I would choose to have. So kind of, equally a fun question. What's your most favorite place that you have traveled to that you just fell in love with?
I just came back from Greece.
That's cool.
Yesterday.
That's cool. Oh,
Yesterday.
wow. Well,
Yeah, yesterday. Yeah, so
awesome.
just came back from Greece yesterday. And we did the Santorini, which is beautiful and everything, but we also do kind of off the beaten path things. And so we went to Delphi, and I really love the ruins, kind of, how interesting it is that human beings have always been curious about the world around them. And so, they have their, the gods, whether it's Apollo or Zeus, and just kind of learning a little bit. My daughter's read all those books. I never did with those books. So I was learning when we went there, and it was just really interesting, just looking at the ruins. And I just find that I had a tug towards that. I'm a foodie generally, so other than so I would say though the food was good, but I think the ruins and just seeing, wow, what human beings. I mean, some of this is like 1600 BC, right? 3000 BC. We also saw kind of the rock where Paul was giving his sermon. So it was just, I think because I'm just coming from Greece right now, I really did enjoy kind of the off the beaten path things that we did. I love the beach as much as everybody else for sure, but I really did kind of enjoy learning a little bit about kind of the history of us as humans and what we've been up to and what we're capable of. I think that was a big thing. It's like, you look at what they created and you're like, how'd they do that? They didn't have any tractors. They didn't have the wheel. They do this. And
I know, it's incredible to think about.
Yeah, and so the guy said they figured it out. And I was like, that is something I think as we as human beings should remember, is that we can figure things out. Yeah. So if you're trying to exercise and you haven't figured, you can figure it out if it's something that you want to do. Okay, so we can figure it out, guys.
I love it. I love it. And yes, from the mouth of a rheumatologist, exercising, walking on your vacation, it's a great place to, explore sort of a new environment, new scenery, explore what's unique about the place that you're visiting, and then also, get that exercise in. So thanks how you incorporated some helpful tips in there too. So awesome. Awesome. Well, this has been such a pleasure chatting with you, and your energy and passion for rheumatology is just, it's amazing that there are people out there who, strive really to make rheumatology a better field and help our patients. So how can we find you? Tell us about your online resources.
Oh, thank you, Dr. Panico. Thank you so much for having me on your show, right? And I think that's something we have in common is that, we're just, I think as rheumatologists, very passionate about what we do. We want to get the word out there about, hey, you don't have to suffer. You don't have to kind of just push through. There are people out there with resources, Dr. Panico in Arizona, Dr. Dada in the Northwest. And so way to get hold of me is if you look at our website, overlakearthritis.com. If you look at my personal site, which has more of my social media activities, you can look at drdada.com. On Facebook, Dr. Arinola Dada. Usually on Monday mornings, I take you on my elliptical and Stairmaster, just to show you, hey, if I'm talking, but I'm doing it, right? And so we also have a YouTube channel where we talk about interviews. You get the opportunity to be kind of that, the air in the room, listening to other doctors, telling you kind of healthy, actionable things that you can do. So that's called Dr. Dada Healthy Life on YouTube, Healthy Joints, Healthy Life Show. And so I think with those resources, you can find me for sure.
Yes, and we'll link to that as well. So thank you so much for joining us today. And thank you everyone for, watching and participating. And and just being here to, hear about things in rheumatology and how we can help you feel better and help with your joint pain and, live and thrive despite your diagnosis. So thank
Love
you.
it.
And we'll see
Thank
you next time.
you.
Thank you.
Bye. Thanks.